Hi, I'm Dr. Eric Janowitz with Synergy Oviedo Chiropractic. I'm the clinic director here. Thank you so much for taking the time to understand your exam and your x-ray results. I just want to let you know a little bit about the practice. The practice has been in Oviedo since 2001, and we've had the privilege to serve 15,000 patients and delivered close to 250,000 to 500,000 adjustments here in the practice. So today I'm going to show you what is causing your problem, help you understand how to correct it, explain the investment, and obviously get you taken care of and get you adjusted. Now, when you look at this slide here, we look at this iceberg. There's two choices whenever you have a health problem. Number one, you can chase the symptoms, the things that poke through the top of the iceberg, or we get to the underlying cause. The problem is, in today's healthcare system, where's the focus? Tends to be on the top, on the symptoms. You have a headache, take a pill for that, or you have stomach issue, take a pill for that, or you're not feeling good, take a pill for that. Rarely is it correcting the underlying cause. Now, in chiropractic, we look at the cause and we understand a couple things. The first thing we understand is that your nerve system controls everything. So for you to heal, you to thrive, you to flourish, your brain has to send energy or information down your spine, which has two purposes. It's going to support your spine, which of course is your posture, and the second thing it's going to do, it's going to protect those delicate nerves. And so when you look at this image here, from front to back, we all know the spine should be nice and straight and erect. However, from the side, there should have three curves: a forward curve in the neck, a backwards curve in the mid-back, and then a forward curve in the low back. And those curves are critical because they act as a shock absorber to allow us the one force that we all face every day, which is gravity. Now, the nerves not only feed the muscles in your back, they also can travel down your legs, causing things like sciatica, or down your arms, causing numbness and tingling or carpal tunnel. But even the nerves go out into the neck and can cause headaches as well. Additionally, those nerves also feed and give life to every single internal organ. So every organ in your body is fed and given life to by the nerves in your spine. So the same nerves that give strength and energy to your low back also give energy to your bowel, bladder, and sex organs and can cause issues there, such as constipation, diarrhea, gas or bloating, or cause an increase in frequency in urination. Same nerves. In the mid-back, those nerves affect the stomach, and those can cause reflux, heartburn, indigestion. The nerves in your neck, the same nerves that go down your arms and your lower neck, also go to your heart and to your lungs, which is why oftentimes if someone has a heart issue, it's the same nerves that are pinching and they feel it in their arm as well, or being irritated. The nerves in your neck can affect your thyroid, can control your metabolism, your immune system. And of course, the neck can go to sinuses, eyes, ears, nose, and throat. So a lot of times people come to us, and when we're looking at your films, we're also understanding what are the other areas that can also be affected. And it's so amazing to me after doing this for a number of years that a lot of times people have failed to connect the dots of what might be causing their problem because of that same area being irritated. Now, when the body goes out of position, the term for that is called subluxation. Subluxation is the clinical term where the body shifts out of position and causes pressure and damage to the nerve system. That can change how the nerves are pinched or not pinched, how the body is moving. That can cause the muscles to tighten and spasm. And if left undetected or uncorrected, it can cause the body to wear away and cause degenerative disc disease and degenerative arthritis. Now, to understand abnormal, you have to know what normal looks like. So if you look at this film here, you can see the spine from front to back. In fact, we're looking at it from back to front. So the left is on the left, the right is on the right. The green line signifies where your spine should be, and the dotted red line underneath that is actually where the spine is. Now, of course, that's what you want to see when we look at your films in a few minutes. Now, from the side, I told you the spine should have curves. So we have a forward curve. This angle along the blue line is a 43-degree angle, and that is what you want to see when you look at your films. If there's one number that I want you to understand, it's 43 degrees. The other thing that you want to see is that the bottom of the neck and the top of the neck are equal. It's not shifted forward, which I'll show you in a slide in a moment. So 43 degrees, and if you look in between the bones, the disc space is thick and equal, and the bones are nice and healthy and square. Now, car crashes cause subluxation, and they definitely need prompt evaluation. One thing I want you to realize is that a part of our practice treats auto injuries because of the damage that it causes to the spine and to the nerve system, but you only have 2 weeks to see a provider if you have an injury. So one thing I want to encourage you to do is I want you to make sure that you are addressing your problem and taking care of it right away if there's an issue there in that 2-week rule. Forward head posture is this condition where the spine can shift out of position in the head, which then causes a domino effect that causes the shoulders to collapse, cause pressure in the upper back, and even your lower back to compensate. So what you want to realize is that if your problem is not corrected, the body will weaken in other areas, causing other problems down the road. And that's what we tend to see with a lot of cases, and hopefully we can avoid that with you. Now, when our doctors design a plan of care for you, we look at the complexity based upon 3 factors. Number 1, the phase of decay. Number 2, your postural complexity. And 3, your symptom complexity. So if you look at this slide here, normal is on the top, and you can see that curve. Phase 1 is where the spine is shifted out of position, but there's no damage to the discs or to the joints yet. We know that problem is 0 to 10 years old. Now, again, if that problem is not detected or corrected, it will spiral into phase 2, where we start to see within that circle degenerative disc disease. And that's pinching and compressing on that nerve. That takes 20 years of damage. So many times I might have a patient come in the office and say, "Hey, doc, I've been having pain for 2 weeks in my neck." I look at their x-rays and I see this degenerative arthritis in the neck. I say, "Well, tell me what you did 20 years ago." So the problem and the symptom may be 2 different things here, which is a really important concept to understand. Now, finally, unfortunately, this can go into phase 3, where we start to see the spine literally fusing and melting. And when it's that way, it's very, very challenging to make this thing work and get it corrected, okay? So things I want you to understand here is, number 1, subluxation is a progressive condition. And if it is not corrected, it's going to decay and it's going to be harder to correct. And the further you are down in the chain here, the more work it's going to take to correct the problem as well. Now, this is an example of a film to help you understand your films, and this is a patient named Ken. Ken came in the office at 42 years old, was having neck pain, was having headaches, sinus issues, numbness in his arms, heart issues, reflux, mid-back pain, numbness in his legs, a lot of symptoms. And he was also a new dad and was having a lot of anxiety because he wanted to be healthy for his child, right? Well, if you look at his film on the left, you can see his head is shifted forward. That yellow arrow is showing that Ken had 33 millimeters of forward head posture, where normal is 0 to 5, and his neck curve should have been 43 degrees, and he was only at 13 degrees, which was a 70% loss. So this is a very severe case to help you see. Now, if you look at the image on the right, you can see that his head is pulled and shifted to the left with that big red arrow you can see, and then and that little arrow there, the smaller red arrow, you can see it's showing the stress point. Now, ironically, right, that stress point is the nerves to the stomach. So Ken was so shocked to learn that his reflux could be impacted by taking care of his spine. And I will tell you, in fact, that it was, and I'll show you his post-X-ray in just a few minutes. Now, we're going to be looking at your films, and the question you're going to be asking us is, how do you correct it? So synergy involves multiple healing arts working together to provide you a result that is significantly better than just doing them alone. And so we combine corrective chiropractic care, which works on the position and the biomechanics and the nerves, combined with physical therapy to strengthen and stabilize the supporting structures, and home care exercises for things to do at home as well. So spouses or significant others, if you're watching this, I want you to know that your significant other is going to be given homework, and I want you to make sure that you guide them and encourage them to do that, which we'll have available on our website for them. Now, if your case is also more complex, we have 2 other therapies. One is called decompression, which is for disc repair. So if the disc is bulging or herniating, producing numbness or tingling in the legs or in the arms, or just severe pain in those areas, or if you have an extremity issue, if you have a wrist problem or carpal tunnel, or an elbow issue, or a shoulder issue, or a hip, or a knee, or a foot, or plantar fasciitis in your feet, we utilize the most advanced Class 4 laser therapy to help heal that tissue to avoid having to take strong medications or even steroids. Now, this slide shows you the physical therapy that we do here. So our doctors may have prescribed to you cervical traction, which is a neck exercise to bring the neck in an optimal position by doing a series of squats, which will strengthen your core in addition to work on your neck. Additionally, on the image on the right, you can see that we utilize chairs with a core stability disc, and we teach you a series of wobble chair exercises to strengthen and stabilize your lower nerve system. So prior to care, your doctor may be prescribing you these exercises to warm up the lower back, to warm up the neck, to provide on the next slide when we show you the adjustment which is the foundation to correct the spine, get the body in a great, healthy, and strong position. Now, the one thing you'll notice in the picture is that we take care of children and families. So the one thing I want to encourage you to do is if you have any children, to please make sure you get them checked to make sure that their body is in a nice, healthy position as well. Now, the correction is locked into the use of whole body vibration. Now, whole body vibration is a therapy that stimulates the body to help to memorize that correction. So think about this. We warm up the body through the exercises. We make the correction through the adjustment, and then we stimulate the body to memorize that change. And then we give you exercises at home to encourage more of that memory being occurring in your body to helping you make a nice postural corrective program for yourself. Now, here's an image of some of the exercises that you'll be given, and they're all on our website, which we'll be showing you through our rehab technicians. Additionally, there are home care exercise equipment. On the top left is called a Pro Lordotic Neck Exerciser, just a neck exerciser to help build strength to the neck, increase strength and endurance to the neck muscles. We utilize a very specific pillow that will help to support the correction so you can be tractioning while you're sleeping at night as well. We utilize the core stability disc, so when you're sitting at home or at work, you can utilize this disc. And then if you are at a job where you're on your feet a lot, we utilize the most advanced orthotic system that exists. This is an image showing you the decompression therapy. The decompression therapy is the most advanced strategy to prevent you to have back surgery if you have a disc problem. It is the most advanced conservative way because unfortunately back surgery has the highest failure rate out of any other surgical procedure. And my wife was an orthopedic nurse and she saw tons of these cases. So if we can avoid surgery and this therapy is prescribed to you, then this is an amazing alternative and it's definitely something that you'll want to take advantage of. Additionally, this is an image describing you the laser, which I told you before works for extremity issues. So laser is amazing at reducing pain, increasing range of motion, decreasing swelling, but most importantly, laser stimulates the cells to give them more energy so that your body can heal. One thing we're really proud of in the practice is that we're part of a foundation called the Foundation for Wellness Professionals. And this is a national nonprofit where our practice is the local representative where we speak to businesses and churches and organizations on health-related topics and really help the community really achieve greater health. And so I have the privilege of speaking every semester to the University of Central Florida College of Medicine, where we educate all the pre-med students on what chiropractic is so that they can help their own patients and wherever they go to serve their patients as well. Now, since our healthcare system is symptom-oriented, as we talked about earlier, the same thing unfortunately goes with the health insurance system. And this is a real unfortunate thing because the system that is designed to get us well is very limited because it only focuses on the tip of the iceberg, just the symptom. Let me show you what that means. Now, to correct your problem, there are 4 phases of care. The first phase is relief care. That's the tip of the iceberg. That's just helping you from your symptom point of view. Now, unfortunately, this is where insurance begins and ends if it participates at all. It doesn't focus on corrective care. It doesn't focus on strengthening that correction, and it certainly doesn't focus on wellness. The problem is if we just treated you for relief care and we fail to correct your problem, what's going to happen shortly after that? It's going to go back. And we don't want to do that. We don't want to just treat the tip of the iceberg. So our program is designed to work through the entire process of relief, corrective, and strengthening through the corrective care model. And how we do that affordably is we've joined a discount medical plan which provides you maximum savings without the limitations of insurance. Now, some of you could be thinking about your family as well, and so we also offer additional discounts on top of that for family members because we serve at the level of family in our practice. Now, the thing you want to realize is that subluxation is a progressive condition. So as you watch this animation, you can see that the body is losing that normal curve, and as time goes on, it's going to compress in the areas of stress and weakness, causing degeneration in the discs and arthritis. And again, the longer the problem is there, the harder it is to correct. You know, I tell people it's never going to cost less or hurt less than it does now, so you want to make sure that you're addressing this problem as soon as we identify it. Now, frequency matters when we make the changes to your spine. So working through this, if any of you played any sports, you know that it's the repetition over time that allows us to be experts at what we do. So a cycle of visits is 12 visits, and we anticipate one cycle for you to feel significantly better. Now, some of you might feel better in 2 or 3 visits, some of you might take 8 or 9, but on average, that first cycle, you should feel pretty good. The frequency is 3 times a week because your body is in an abnormal position, which you'll see in a few minutes. We put it in position. Over time, it's going to want to shift back to that position. The adjustments re-educate the body to make that change over those 12 visits. And then that transitions to corrective care. Corrective care is going to be 1 cycle of 12, 2 cycles of 12, or 3 cycles of 12, depending upon what phase of decay you're in. So if you're in phase 1 and we see no arthritis, thank God for that, because that will only take us 1 month in the corrective phase. If it's more complex, it will be 2 months, or even more complex, 3 months there. That will then allow you to transition and graduate to the strengthening phase. We reduce the frequency to twice a week for 6 weeks, and then at that point, we get to take your post x-ray. Now, this is our clinic's favorite time when we get to celebrate all the hard work that you've done throughout your corrective process. So between 3.5 months and 5.5 months, we'll take your re-x-ray, we'll put your film that we're going to look at in a few minutes right now, compare it to the film in the future, and you can see exactly how your body's done and how your body's holding, which is an amazing time, and we have a lot of success in that visit. This is some examples. So Christine had an auto accident. You can see that on the left side, she had no curve, 0-degree curve, a lot of compressing. So her head, instead of acting like a spring, was jamming on her spine, causing a lot of neck pain and a lot of pressure and headaches. Through this series of corrective care, same processes that we're prescribing for you, we were able to bring a 47% improvement in her spine, and she was feeling great. This is Ken. We talked about him earlier. You can see that forward head posture was 33 millimeters, and now he's a 60% reduction. So imagine having your head shifted like this, all the tightness here, and as we're correcting it, bringing it back, all those muscles relaxed, and his energy went through the roof as well. This is his post x-ray as well. Again, the left is the pre, and his post on the right, you can see that shift and kink, compressing and damaging those nerves, is taken off of that pressure by putting his body in a healthy position, and Ken's doing great right now. Ironically, which was really neat, is he would say that his sinuses would open up when he got adjusted. Now, Sarah is another case. You can see this is a low back, so this is the pelvis on the bottom, and you can see the spine drifting off to the left, and you can see the spine corrected on the right side there. Again, pre to post x-ray of our patient. Now, I want to share with you, before we go over your films, our vision, because our practice is very vision and very mission focused. And our mission is to love, serve, and inspire you to help our community live life more abundantly. So we really exist to help bring out the best in you and the community that we serve. Now, this is my family, Dawn, and my daughter, Journey, and my son, Asher, and we're just super excited to serve you. And I just always tell our patients that you can make a difference by sharing and giving hope to others. Now, when we look at your films in just a moment, we're going to ask you just a few questions with the doctor. We're going to ask you, A, what do you see? We're going to start from the nerves in your neck. We're going to look at that side view. That curve should be 43 degrees. We'll see what yours is. Forward head posture should be 0 to 5. We're going to ask you, what do you see? We're going to ask you, what is it causing to your body right now? You may be feeling it right now. You can tell us. And then we're going to go through the rest of your spine. We're going to look at the upper nerve system and the lower nerve system. And then I'm going to ask you, what do you think is going to happen if you don't do anything to address this? If you just leave it the way it is? Is it going to get better, worse, or the same? And then finally, what needs to be done? Are you ready to take the first step in getting you to achieve your best life ever? So on behalf of all the doctors and staff here at Synergy Oviedo Chiropractic, we are thrilled to be able to serve you and your family. Thank you.